Hello, I'm Jawad, Executive Medical Director at East Lancs Hospital NHS Trust. As colleagues will remember, the last time I went around, it was one of the clinical areas, and it's so important to show all of you how the hospital in general works together to bring out the best in delivery of healthcare. And today is one of and such a department which is so pivotal and, in all fairness, the backbone of the hospital in regards to the delivery of safe medical care. This week is Ask a Pharmacist Week. So what better opportunity than to be in a department which, as I said, provides such an important element of patient safety. I'll introduce you to Vince, and I'll let Vince get along. First of all, to say who is he, what he does, and then we'll have some questions for Vince to expand on. Vince.
Okay, thank you. Thank you for that very flattering and kind introduction, Jawad. So my name is Vince Goodey. I'm Assistant Director for Pharmacy here at East Lancs Hospital. And I guess really what I want to say is pharmacy, we have a very, very simple mission in the Trust. Our simple mission is quite simply to do what we can to make sure that for ELHT patients, we make sure that the right medication is available for those patients at the right time. And that's a very simple statement, but actually that's our mission. Underneath that, there's a great deal of complexity. And I guess we'll just have a wander through that in the next minute or so. We're interested in making sure that that care happens right the way from the emergency department, right the way through to our admission areas in the Trust, emergency surgical unit, acute medical unit, through to the inpatient areas behind that, right the way through to our community hospitals. But of course, ELHT is about much more than emergency care. It's also about elective care, and it's about management of some long-term conditions as well. In addition to that, we have a role in the Trust, which is around making sure that standards are correct for the use of medicines and that we're handling medicine safety and keeping patients safe all the way through that. And providing the support in terms of answering queries and giving advice to our fellow healthcare professionals, which is in a way where the Ask Your Pharmacist Week comes in, you know. So we're there to support you every step with your use of medicines.
Thank you. So what you've done basically, Vince, is explain what pharmacy is, and it does, but also what areas in the hospital it supports. So as you said, right from the unscheduled to scheduled care, from acute to elective patients, and most importantly, you also provide that support to our junior medical and nursing staff, or for that matter, senior staff, because I could be ringing you and saying, Vince, what should I be doing about this drug, or do we have an alternative? So it's a great support service in helping people who are on the front line, and you are on the front line, to write up to ensure that correct medicines, correct dosage are being dispensed to the correct routes. So when it comes to your support for the hospital, you've mentioned, what about the community pharmacy? How does that role work, and what happens?
Well, we do have a strong and building relationship with community pharmacists in terms of the work we're doing, or actually work we've had in process for a long, long time now. We've been in a fortunate position to have developed a local system which enables us to share information about patient admissions and medicines at the point of discharge to community pharmacies when patients are discharged from us, and that's our Refer to Pharmacy system. It's developed locally and it's now being adopted across the wider healthcare areas outside of East Lancashire or Pennine Lancs. So the Refer to Pharmacy system enables us to provide up-to-date information and to prompt further actions by a community pharmacy after patients are discharged. But it's an example of a collaborative working with community pharmacy, which years back didn't exist. So we're very proud of that.
Yeah, no, that's good, and it's really good to know how as a system we work together. And I don't want to check your mathematics or arithmetics, but any number that you can of the amount of prescriptions or the things that go through your system with community?
Well, in the last financial year, we hit a target of 760,000 transactions with medicines dispensed or managed through the pharmacies across the trust across East Lancashire. So that's 750,000 of transactions with medicines. It's a huge number, isn't it?
That indeed is. Just shows the enormity of the work that the pharmacy department and colleagues in there do. So thank you for that. And I think finally, to bring to an end this conversation, it's important to emphasize that delivery of healthcare is just not about doctors and nurses. It's about the blended workforce, which comprises of doctors, nurses, allied health professionals, or operational managers who will deliver the right care at the right time at the right place. And our pharmacist colleagues are one of those. So thank you for listening to today's update. See you next time. Look after yourself and your loved one. Bye for now.